Hey everybody, great episode here with Scott Greenberg that we talk about some great ways to utilize BFR. So if you've wondered how BFR might be able to help you with a acute rehab athlete, making sure that they're maintaining their aerobic fitness, how BFR might play into that, this is a great listen. You'll definitely want to hear. We go into some topics about how do you prescribe intensity, what type of occlusion can you use. We talk about even topics of can it be used for recovery. So a really good one that if you're working with athletes and you've got BFR and you're wondering if you can use this, it's a great way to get a little more insight on how BFR might be a great tool for you. I'd highly recommend you head over to the RunDNA YouTube channel to see the slides. Scott has some great slides with some references and some charts that are worth checking out. So I hope you enjoy, and thanks for listening to the RunDNA podcast. Hey everybody, welcome. RunDNA here. Doug Adams with Scott Greenberg. Many of you know Scott Greenberg from RunDNA courses and his work with Florida Gators as physical therapist for athletics down there, manager of operations for UF Health, director of residency programs, and just a great source of information about lots of things running. And BFR is a topic very near and dear to him. So I'm excited personally about this, just to talk a little bit more about a different aspect of BFR, not just how most people think of it for strength, but from an aerobic standpoint, because we get a lot of questions about what should people do for off-season training or to keep their fitness if they're injured. So hopefully we'll go into some of that stuff. So without further ado, Scott, why don't you take it off here? And as always, put your questions in the comments and we can put them up on the screen as we go, or we'll answer them at the end.
Awesome. Thanks, Doug. Super excited to be here talking about, again, like Doug said, something that's really influenced my practice over the years more than many other tools that I have in my toolbox. I'm a big blood flow restriction fan. Traditionally, the way it's pretty much being utilized by most people is for hypertrophy. And so what I wanted to dive in today and kind of go over is blood flow restriction beyond hypertrophy. What else is out there in the world of blood flow restriction training, and how can we use the technology and the science to help benefit our runners and our patients in other ways? Now, to put the cart before the horse here, I am going to say that hopefully you leave today with more questions and answers, because to be honest with you, we still have a lot more to learn regarding some of the other ways in which people are starting to implement blood flow restriction training. So that's fine. And I think we're off to a good start with where this is taking us, and the science is there to back it. We just need more studies out there to support what is happening scientifically from a more clinical standpoint. So again, we're going to start at the basics. So what is blood flow restriction training? First and foremost, it's a method in which we're partially restricting arterial inflow and we're fully restricting venous outflow during exercise, or as we'll see later, maybe not during exercise, maybe during some other things. And like I said, the goal and the reason why people use blood flow restriction training is because it traditionally allows for an environment to be created that is very similar to that created when we're striving for traditional hypertrophy, lifting heavier loads. However, with blood flow restriction, we're able to use much lower intensities to create that environment and stimulate the response we're looking for. So again, in areas where, patients cannot tolerate heavy, resistance, traditional resistance loading type of protocols, blood flow restriction training can be a great adjunct to fill in the gaps in those times. Now, again, I will say, as always, there is no substitute for heavy resistance training and loading. However, we all know that certain tissues, whether it be postoperatively, injured, maybe in season training, we don't want to put that same load through the tissue, that blood flow restriction has been a great, like I said, tool for us to utilize to help benefit our patients and our athletes, for that matter, too, our healthy ones. So like I said, the applications are numerous. You can use it in sports medicine, whether it be acutely. You can use it for rehab. You can help with pain. It's got some analgesic effects to it. You can also use it as a performance mechanism to warm up or precondition a tissue, get some of those type 2 fibers stimulated a little bit earlier than normal. You can help with strength training. And what we're going to talk about today is how we can maybe implement blood flow restriction training to help with aerobic capacity and touch a little bit on recovery. So this slide is just going out there, and this is among many research papers out there that just show that blood flow restriction is basically a safe tool for us to use when implemented properly, okay? With that being said, there are situations in which you probably shouldn't use blood flow restriction training, and those situations are if somebody's got a clotting disorder, hypertension, past history of a DVT or a pulmonary emboli, history of stroke or a hemorrhage. Those are issues in which, for me, are a red flag, no go. But there are situations where we'll have a yellow flag or a yellow light, meaning, you know what, I will do it, but I'm gonna go a little bit slower. I might be a little bit more cautious. Like, for example, it says here that surgery in the past 4 weeks. Well, I use blood flow restriction training day one postoperatively. I sometimes use it day one on the other side, the contralateral limb, let's say, but I will use it very, very early. And I may even implement it on the involved side postoperatively, anywhere from maybe a week to 2 weeks after the actual procedure. So I do use it, especially for our athletes. If we look at travel of no more than 4 days or a flight in the past 7 days, again, that's not really realistic. We use it very, very often. But again, we do want to keep those things in the back of our mind when we are implementing this type of tool, this type of treatment modality. And we want to monitor our patients as well. And how do they respond to it? As we all know, certain modalities pique the fancy of some of our patients more than others. Some of them prefer laser. Some of them prefer needling. Some of them hate needling. Some of them love blood flow restriction. So know your patients. Get to talk to your patients. And we all know that, if a patient doesn't like a particular treatment or if they don't feel it's benefiting them, chances are they're not going to get that much benefit from it. So talk to your patients. But again, with regards to these relative contraindications, I'll call them, you can do it. Just keep, caution in the back of your mind. So like I said, we're going to talk about endurance training. And, if we're looking at improving somebody's endurance capacities, we really want to strive at focusing on 3 different areas: their maximum oxygen consumption, or otherwise known as their VO2 max, their onset of blood lactate accumulation, we're going to call it OBLA throughout this conversation, and then lastly, the economy of motion. And those 3 pillars, we'll call it, are really what make up somebody's ability to sustain endurance activities at a high capacity. We do know that traditionally high intensity interval training is a very, very effective method for improving VO2 max and OBLA. What we have also noted that it has very minimal effect on improving economy of motion. Therefore, we have noted that BFR may be advantageous to implement as an adjunct or an alternative to high intensity interval training. And we'll go into the details as to why. So why would somebody want to first and foremost consider blood flow restriction training in an aerobic environment or to improve aerobic capacity? Now, again, if one of your athletes is injured and they want to maintain their fitness, but yet maybe they can't tolerate running or they can't tolerate the long aerobic sessions to improve their VO2 max, let's say, or to improve their body's ability to buffer lactate, blood flow restriction training is a great way in which we can utilize shorter treatment sessions with higher intensities than they would normally kind of deal with because of the stress that occlusion creates. Like I said, blood flow restriction is a treatment in which time is of the essence. You don't want to wear it for very long periods of time. As we'll talk about 20 minutes is about as long as you want to wear it. So it is great if you have a short amount of time and you want to get a lot of bang for your buck. And again, even if you are a healthy athlete, it could be a great adjunct to your training. So like I said, VO2 max represents the maximum amount of oxygen the body can utilize during intense exercise. And, when you're doing endurance running or cycling, our body relies heavily on aerobic metabolism to produce that energy. And thus, a well-developed VO2 max allows the athletes and our patients to effectively and efficiently utilize that oxygen to fuel their muscles, delay the onset of fatigue, and maintain high power and speed during their activities of performance. So where does blood flow restriction come in here? Well, we know based on several studies that BFR does increase VO2 max in well-trained males, but how does it do it? Well, number one, it elevates the heart rate, increases cardiovascular stress, thus the BFR-induced ischemia and reperfusion, increases femoral artery diameter, enhancing oxygen delivery during the exercise to that muscle. It also increases stroke volume and cardiac output. But again, just by putting the blood flow restriction or blood pressure cuffs on your leg doesn't necessarily mean you're going to get an increase in your VO2 max output. Okay, you've got to exercise at an intensity that really facilitates that response. So again, exercise intensity is critical when prescribing BFR activities for the purpose of inducing cardiovascular stress for adaptation. When we're talking about onset of blood lactate, that's really when, we've all had it. When we exercise and lactic acid builds up in our muscles where we can't continue that activity at the current intensity that we were, because again, it's just unbearable to kind of do. That means that the clearing of the lactate was slowed in relationship to the buildup, and you couldn't clear it anymore. And as a result, fatigue sets in. So with the use of blood flow restriction, we're finding that it delays the onset of this blood lactate accumulation via training, and the athletes can thus sustain higher intensities for longer periods of time, thus improving their overall performance. And to be honest with you, preliminary data is showing that blood flow restriction training for increasing the onset of blood lactate accumulation is actually more likely than that of increasing VO2 max. So when you're really inducing or utilizing blood flow restriction training to improve aerobic capacity, you're really mainly getting the benefit from the pushback of the onset of blood lactate levels in the body. And it achieves this via angiogenesis, enhancing oxygen extraction and metabolite removal. But usually, blood flow restriction therapy improves lactic acid buildup by increasing intracellular buffering, the capacity to kind of allow the tissue and the body to tolerate that lactate buildup for longer. And we still have a lot of work to do as to understanding whether we should be doing continuous BFR, intermittent BFR, active or passive strategies for it. So again, like I said before, there's a lot of work still to be done on the parameters of its utilization, but we know that the science is there by creating these type of responses, and that has been heavily studied. Lastly, we're going to talk about economy of motion. And the way I like to think about economy of motion is basically a bigger, stronger muscle is going to work less hard at producing an outcome versus a weaker muscle. And it reflects how effectively an athlete converts metabolic energy into mechanical work. And if you have efficient movement patterns, it reduces the energy expenditure. We talk about this with running all the time, right? If somebody moves efficiently, the amount of energy they're going to have to expend is going to be less, thus allowing for greater power and speed output because that capacity is there. Athletes with superior economy of motion can sustain power or speed outputs with less metabolic strain, thus enhancing their endurance capacity. And really how it achieves this, we're still kind of playing with that a little bit. Again, very, very limited research. We need more research on this topic, but we do believe that it's got an influence on the sodium and potassium ATPase activity, which basically improves muscle force generation. So again, by improving muscle force generation, we're able to improve that economy of motion, thus allow us to be more efficient and effective with our movements. This here is one of my favorite slides of all time, especially when we're talking about this particular talk or any BFR talk. Moving forward, I'm going to have this slide in every single one of my BFR talks. Reason being, because I feel it does a wonderful job of encapsulating all of the different metabolic and all of the other processes that occur due to implementation of the tool, which is blood flow restriction training. So there's an acute response. There's an acute muscular response in which there's an increase in mTOR activity. There's cell swelling, as we all see. Increase in satellite cell proliferation. From a metabolic standpoint, there's obviously metabolic stress buildup. There's decreased O2 availability due to the occlusion. With regards to the cardiac response, there's a decreased stroke volume initially, increased cardiac stress initially, and then obviously from a vascular perspective, we create a ischemia reperfusion injury due to the occlusion and obviously more oxidative stress. But because of that acute response, what are the training adaptations we're looking for? We traditionally know that from a muscular standpoint, we see maximum strength and muscle hypertrophy as a result. That's usually what we go for. But from a metabolic standpoint, we'll see, again, increased diffusion rate, increased blood resistance times, increased capillary density. We'll see increased buffering capacity, like we talked about, decrease in metabolic accumulation. We talked about the NAK ATPase activity. Again, the list goes on and on here. From a cardiac standpoint, you can see an increase in stroke volume, like we talked about, an increase in cardiac output. We're going to see that increase in femoral artery diameter from a vascular standpoint. So those are all the different training adaptations. What you'll also appreciate from this is that, again, not only do muscular acute responses or muscular adaptations contribute to the economy of motion, but you can also see that there are some metabolic ones also. And so there's a little bit of crossover with all of this. But again, I really, really like this slide because it talks about all the different ways in which blood flow restriction training can help the numerous systems. And again, some are more traditional than others, but there is some overlap in the entire system. So this is a great reference for you guys to go back to. So I thought a good study to highlight some of this was this one. This was an 8-week study in which there was a 20 subject pool split into 2 groups. One group ran with blood flow restriction cuffs on. The other group didn't. They did the exact same run. Just again, the only difference was that one ran with cuffs, and those cuffs were pumped up 1.3 times their resting systolic blood pressure rate. And they looked at things like the VO2 max. They looked at muscle mass, isokinetic muscle strength, and hormones. And they did this before the treatment, in the middle of the treatment, at the end of the treatment, at the end of the 8 weeks. And what they found was that the group that ran with the blood flow restriction cuffs on exhibited significantly greater increase in VO2 max and isokinetic knee extensor strength. They had higher leg muscle mass, and the testosterone to cortisol T to C ratio at 24 hours after training, both pre, mid, and post training, were maintained in the running group, whereas in the other group they weren't. So that just shows, like, cortisol we know is a stressor, and we want to kind of limit that after an activity, right? And testosterone is a muscle building hormone in which we want to try to maximize, and that was maintained for longer periods of time in the group that used blood flow restriction than that didn't. So again, a very, very positive result. Again, more work needs to be done, but again, one of the first that really kind of talked about this. Another group, this was kind of interesting too. They looked at 10 men over 6 weeks, and they basically did cycling with one leg cuffed and the other leg not cuffed. And only the cuffed side increased in the femoral artery diameter, which was kind of neat, which we talked about was a vascular response. And the BFR leg got better at using oxygen and didn't release as much lactate during easier exercise. Again, showing a benefit to that type of treatment modality on the involved side. So again, small study, 10 people, short period of time. More work needs to be done, but again, very, very promising.
Hey, Scott, for both of those, were they doing interval-based training with it or more endurance-based training? Did they kind of talk about any of
More
like
interval.
training?
More interval.
And
Mm-hmm.
for the other one too, that was more of an interval-based one?
Yes.
Okay.
Yeah. They
And we
did
did have,
heroes. It says it right here. They were at 50% heart rate, reserve 3 minutes for 5 sets.
okay, perfect.
Yep.
And there was one question, a good one from Denise, just about that chart that you had. It
Yep.
talked about somewhere like light gray versus dark. What's the light gray versus regular font mean? Like lesser benefit, like under intramuscular, the last one, capillary density, is like a light gray versus the other ones are a black.
Yeah,
Any,
that's a great question. And the way I took it is probably the research to support it was probably
yeah,
not as strong.
not as okay.
Mhm.
That's what it looked like. So thank you.
So, in all of the blood flow restriction work we do, we're really trying to determine the pressure. And the first thing you have to do is determine what the limb occlusion pressure is first, right? So, just like you would normally do for traditional blood flow restriction training, have the patient supine, have them rest. Depending on the system you're using, it may differ in terms of the time, etc. But just realize that whatever pressure you take, there is a trade off between the pressure, the exercise, and the training adaptation. So, greater cuff pressures reduce performance acutely, but may not hinder the training adaptations you're going to see. And the selection of the pressure should allow for the completion of the prescribed exercise volume for optimal training outcomes. So as we'll see here in a little bit, how can you best determine what that will be? We're going to find out oftentimes it's athlete kind of generated. So, as most blood flow restriction protocols say, don't use more than 20 minutes per session. This is saying, or these are basic recommendations. And again, we do need more research as to the optimal level of this, but most people say 2 to 3 times a week, somewhere between the 40 and 80%. Again, you can go higher on the lower extremity than you can on the upper extremity. But again, because of the limitations for long duration aerobic training, blood flow restriction training is a great alternative because of the fact that, again, you can get the work done in less than 20 minutes oftentimes. The problem is understanding, some of the prescription and understanding where you sit in terms of the response physiologically that the athlete is having, because things like heart rate calculations are not necessarily true based on the physiological demands due to the venous pooling that occurs with blood flow restriction. So like I mentioned just a second ago, self-paced intensity approaches seem to be the best, in which you tell the athlete what you want them to accomplish, and they need to push as hard as they can to accomplish that goal. So they can self-regulate how hard or how intense they're actually cycling or running or whatever that may be. And we do
And
know
that's similar, like, sorry, just to interrupt Scott
uh-huh.
there, but like that's similar to the principles like we talk about in the endurance coaching course of effort-based training. And that's
Yes,
in mind because especially if it's going to affect heart rate accuracy for some of those things, or it's, you're not testing your zones, zone one, zone two through five or so with
can.
BFR on. So training with intensity based is really helpful with that. That's something we talk a lot about in the endurance
Yep.
course. So,
And there's on the next slide, you'll see another way in which you can look at it.
yeah.
Um, but optimal pressure is likely the highest percentage that you can achieve without reducing the volume of the activity that you're doing. So whatever that may be, that optimum pressure is where you can get the most bang for your buck without losing the volume that you're shooting for. But like you were just talking about, Doug, if there was a way in which we can look at a ratio between like some of the internal demands versus the external, like heart rate being an internal demand and power output being an external, and looking at those ratios with training, you can get some insight into whether they're over fatigued or if their fitness is improving or not. But again, more research needs to be implemented as to what exactly we're looking for specifically with those ratios. And again, uh, so much is out there with regards to, even if we're talking about for hypertrophy changes, is it the 30, 15, 15, 15? Well, not necessarily. I do a lot of blood flow restriction training that's much different than that. Like when I do my foot and ankle stuff, I'm working in repetition ranges of 60, maybe 3 sets of 60. Some things are time based. The goal is to create that fatiguing response, and whatever the tissue load is that you're using, you have to make sure that you achieve the response in the tissue from the load you're imposing. So I don't feel like yellow TheraBand poses a load adequately enough when you do a 30, 15, 15, 15 set. Therefore, I tend to go, like I said, higher reps or even use higher resistance band to achieve that. So for the last couple of two slides, we're going to talk a little bit about recovery. And I only have 2 slides on this because this is even more in its infancy versus the aerobic side of things, the aerobic and endurance strengthening capacity components. This was a systematic review, a Cochrane review done in 2024. So this year it was published, and only 11 studies were kind of found to meet their real criteria. And of those, only 2 utilize active recovery, in which you're actually moving, whereas 9 studies use more passive, where you put the cuffs on and you just sit there. And oftentimes, when I work with some of the companies I work with, the occlusion pressure you can use is 100% occlusion. It's possible to do that. Some people really enjoy that and feel the benefits are there at that high occlusion level. I know a lot of the professional baseball organizations are utilizing recovery. We actually use it some in one of our training rooms with our football team at times. But again, more studies need to be out there with regards to what is the most beneficial way to implement this modality for this type of utilization, we'll say. Um, but but there is some promising findings, as you'll see here in a second. This was a pretty, I'm going to say, I think it was 2012, in which they looked at 14 participants, and they looked at things such as power, strength, and speed. They had an experimental group and a control group. The experimental group used pressure of 220, and the control group only used 15. They were cuffed for 2 sets of 3 minutes. And what they found was that specific benefits of recovery showed increase in power and sprint performance immediately, as well as 24 hours after the unilateral occlusion was applied to each leg. So, again, not a whole lot of studies out there to kind of hang our hat on, but this was interesting. I thought that this was one in which hey, maybe we can start to build off of this. So we really need to be continued as to how do we best implement this? What times do we use? How often should we utilize this? Should we utilize it after every treatment session? How long? What's the cuff pressure? Should we be active? Should we be doing it passive? Like, what's the best way? We're not really sure. We know some of the mechanisms in which it could work, as we showed you on that big slide with all the different metabolic pathways that kind of get stimulated via the use of blood flow restriction, whether it's vasodilation, whether it's increased buffering, whether it's clearing, all of those things may, whether it be increasing some of the hormonal responses, all of that is on the table. We just need to understand a little bit better. So in summary, there's evidence out there that blood flow restriction training can help improve VO2 max. It definitely can improve the onset of blood lactate, and then potentially have an influence on the economy of motion that traditional high intensity interval training does not do. We need to be careful as to how we implement this because we really don't know exactly the best way. But monitor your athletes, see how they respond to it, and then adjust accordingly. But there is definitely a research gap, not only with the implementation of BFR for aerobic improvement, endurance performance, but also with the use of it for recovery as well.
Yeah. Awesome, Scott. So if you have questions, start putting them up in there. Love the last slide here.
Yeah.
Yep. Let's go. Olympic trials in a couple weeks here. So
Yes, she is. That's my daughter going to the Olympic trials in 2 weeks for
nice.
diving.
Nice. So start putting your questions in. Scott, I thought of a new study for you and I to do. We're going to
Okay.
do BFR and we're going to look at the implication on running biomechanics to see if we notice any difference in biomechanics. Because that was my thought of like, okay, well, if we're doing this, let's say that somebody can get the same benefits of they're running at an 8-minute pace, but it's the same as them running at like a 6-minute pace. But are they changing their mechanics at all? Are we putting some different like mechanical stress on the body in a different way that
Hmm.
might be impactful, right? We see people in shoes that can be like very cushioned shoes. They're often likely to overstride a bit and change their mechanics. So I'd be really curious just so that people know, like, hey, it's not that you shouldn't do it, but maybe you need to pay attention to form, particularly with running it. Do you have any personal experience that way or?
To be honest with you, I don't like using the cuffs for running.
Yeah.
For increasing, trying to work on endurance capacity. I'd much rather have people cycle with it
Yeah.
personally. Um, just because, again, I don't love the idea of run personally. Again,
Yeah.
personal. I don't love the idea of running with the occlusion because I think the effect it's going to have on the lower limbs when you're striking the ground and having to absorb four. I don't love that
Well,
personally.
that's kind of why I said that. I was like I haven't used it. I use it. The times I've used it has been uphill walking.
Hmm.
Is the time that I have used it
The
there because
elliptical, the elliptical is great. The elliptical
yes,
is great because there's no real impact. You know, I don't have to worry about them necessarily falling down because a lot of times they're holding on to the handles. Cycling is my favorite to
yeah.
utilize it
But
on.
I looked up a couple studies, and studies are having people do interval training
Hmm.
with
That
them
one
while
study I
running.
showed you, they were running with it. Yeah, that
Yeah,
one study. They looked at two groups. One ran with the cuffs on, the other
yeah,
one ran without the cuffs on. So they
yeah,
do it. But again, for me, it's not my favorite thing.
yeah,
I think you can achieve similar adaptations in a different way.
yeah. Yep. All right, we got a couple questions here. First one. Scott, I know, has some opinions on this here. So, Scott, why don't you take about brands of BFR that
Yeah.
you prefer?
So I've used a lot of them. I've used four of them in my clinics. We have four different brands over the course, in my 14 clinics that I oversee. Um, disclosure, right out in the beginning, I am an educator for Suji. So Suji is one company I believe in. I know the ownership there. I believe in the people. I believe in the product, and it's a wonderful product. I love the fact that you're not tethered to a device. They have a unit that is completely wireless, so you can do. But unlike the Delphi, let's go to the Delphi. The Delphi is the gold standard, right? It is a wonderful machine, expensive, but you're always tethered. And if you want to do it on both limbs, you have to have two units, right? So, and it's five times five times more expensive than a lot of these other ones we're going to talk about. But again, it's the gold standard. It is the one that auto regulates the pressure, which again, I personally am not a super big believer in the auto regulation feature. But like I said, Suji is one I like because it's app based. It's about anywhere from $800 to like $1,000 for a whole big set of two uppers and two lowers. You can do both uppers and both lowers at the same time if you wanted to with the same iPhone. You don't need multiple units to kind of make it happen. So I really like that one. Smart Cuffs is another good one. I don't personally use that one as much. One of my clinics uses it a little bit more. A bunch of my clinicians there really like it. So again, a good product there. The Delphi, again, in our football complex, every single one of our tables in our football complex has a Delphi unit sitting right next to it. So I use that one quite a bit when I'm there. I use Suji when I'm in one of my other facilities. So I play with all of them, and they all have their pluses and minuses. The Suji for me is very, very quick to set up, which is something I really like. And the biggest thing for me is the tethering. I don't have to worry about carrying that cart around when I go from patient to patient, station to station, exercise to exercise, having them worry about tripping on the cord and having it get caught on something and what have you. So another one, Be Strong is not my favorite. That was one that was more of a hand pump in its infancy, very inexpensive, not a super expensive, but hard to regulate the pressure that you're looking for. There's no calibration process with that one, so that's a problem. But there's Saga is another one, and Hydro is another one that's come out. I haven't touched those or played with those, or Hitro, I think it might be called. But a lot of them are doing very, very similar things. It's your own personal preference. But again, what we talked about today, it shouldn't really matter which unit you use. They should all have similar results.
Yeah. Before we go to the next question, there were a couple of questions just about like slides and resources and things like that. The replay will be available. The slides probably will not be available, but they're asking for the reference link to that BFR chart. So
Yep, it was a
Scott, if
Smith
you
one.
send
I
it
have
to
it.
us,
It
yeah.
was, let me see if I can pull it up here. It was Nathaniel D. Smith in 2022.
Okay. And maybe what we'll do is we'll send it out with a
I
replay
wonder if I
when
can
we
put it, can
do
I put it
this.
into the comment? Can I put it into a
Yeah.
comment?
Try to put it in a comment, let's see, and then we'll put it up on the screen. See if that works. Yeah.
That
All
work?
right, there you go. It's in so you can copy and paste that for if you're there. So let's go
Yeah.
to Andrew's question about particular pathway of BFR for use. Cellular swelling initially and progressing from intermittent to constant pressure. So, any thoughts from you on that, Scott?
Are we talking for what use? Are we talking about for hypertrophy? Are we talking
Hypertrophy.
for aerobic conditioning? Um,
So maybe Andrew, why don't you clarify that, and then we can answer Lauren's question here. If there's any certification necessary to implement BFR with athletes.
No certification. No certification. What
Yes.
we do in our clinic is we make sure that our clinicians are. We have a little BFR lecture that we give them, and we have like a 5-question test at the end, just to
Mm-hmm.
make sure that we have competence. We show competence. We have competencies for every piece of equipment we have in our clinic. So that's just something that we implement. But in terms of the scope of being a physical therapist implementing this, no. Just like eStim, you don't need a certification to do electrical stim or ultrasound or iontophoresis. Same type of thing.
Yep. All right, next question, Jeff. Are there time frame guidelines on how long BFR? I think we talked a little bit about 20
About
minutes
20
there, but
minutes. About 20
yeah,
minutes is about as long. Now, what I'll do oftentimes if I have a bunch of exercise I want to do, I'll deflate the cuffs for a little bit and then I'll reinflate them later on. So, we're
yeah,
talking about 20 minutes of complete occlusion for that duration. But there's nothing to say that you can't, do like a 10-minute session, give them some time off away from it, and then bring back, do a couple more sessions, a couple more minutes with it on as well. So that's totally fine.
yeah. Andrew clarified that it was, either for hypertrophy or endurance. Is there some acclimatization period basically needed or progression?
So every patient's going to be different. I I work with athletes, and generally speaking, they're pretty tough. I start with 80% occlusion most times, especially when I'm dealing with the lower leg. And again, if there's a reason why a patient is just struggling, can't complete the repetitions that I want them to, yeah, then I'll bring it down maybe during the exercise to 70s, so that again I get that time. It is time based, right? So if you just do an exercise with the BFR on and you're only occluded for 3 minutes, chances are you're not going to get as much benefit if you did the same exercise for a prolonged period of time. You're giving it's in the intensity and the buildup of that lactic acid and that metabolite that we're really looking to achieve. And really that's the end goal. So if you do BFR and let's say you go through BFR and you're not really inducing a fatigued response, I think you're missing you're leaving some meat on the bone. So, for example, a lot of my protocols, I'll do a 30, 15, 15 failure set. So I'll say, give me 30 reps, give me 15 reps, give me 15 reps. And then that last set, if you can only do 12, that's fine. Only do 12. But if you can do 18, do 18. Because I really want to fatigue them out in that last set, especially if it's the last exercise, last set. I want to make sure that I get everything out of them I can.
Perfect. All right,
Yeah.
Eric's question:
Yes.
has
The
anyone
answer is yes.
done work combining eSTEM and BFR for
Yes.
injury recovery performance?
I do it all the time. I do it a lot with post-op ACLs. I'll do some stim on the quad while I'm doing some quad setting, let's say. And I think it's a great way to, again, elicit a little bit more of that hypertrophic or that hypertrophy response, and really stimulate that quad in a situation where they may be struggling a little bit to kind of feel that activation.
Perfect. Well, Scott, lots of great information. Great great research as well, but obviously needing more. Looking at that, it seems like a lot of this is interval based training as opposed to more like sustained zone 1, zone 2 type training there.
Yeah.
I find that interesting. I found the training zones or training intensity based off of perceived effort is a great way to kind of regulate, to know in the absence of research based protocols. And even we know research, sometimes you still have to apply it to the
And
patient in front
output
of you.
too. So
Yeah.
those perceived, so what are they feeling? How hard do they feel they're working? As well
Yeah.
as like how much power are they generating on the bicycle, let's say,
Right.
how many watts are they able to generate on the bicycle? Something along
Right.
those lines are really, really cool metrics to kind of look at over time.
Yeah, comparing pre and post, we should always be measuring our effectiveness of what we're doing and proving our value and what we can do there with it. So I think that that's really important that we're looking at that as well. But I do, think, especially if you're working in more of an acute setting and you're working with patients before they can run, before they can do some of those things, looking at some of that, or somebody that's at a reduced capacity.
Mm.
So
The other thing I didn't mention, which is actually interesting with the Suji cuffs, they are water resistant, so you
mm,
can swim with them. So
yeah,
again, you're not tethered to anything. At least the older ones, the ones that so they have two models. The old model didn't have the wireless capabilities, so you did
yeah,
have this external pump that you had to hook up to it to get it pumped up, and then you took the pump away, and then you were wireless. But the new model has this actual I guess Bluetooth capable device that is able to kind of get turned on and turned off and pump. I
yeah,
wouldn't go in the water with that one,
yeah.
but that was one of the cool things about the Suji initial ones is that they were waterproof and you could swim with them on your arms and legs and get a similar response. So again, as long as somebody's swimming, able to swim and they're not going to get themselves into trouble and drown on you, I think it's another cool a cool way to implement it.
Nice. All right, Scott, where can people find you if they want to learn more about this and check more
Sure.
stuff out about this?
So I'd say the best place to find me is on Instagram at scottgreenberg.dpt. That's probably the best place.
Perfect. Very good. So, Scott, always a pleasure. Thank
Thank
you
you
all
for
for being
having me,
on.
Doug. Appreciate it.
Yeah. So, and as always, if you want more great content, make sure you're heading over to Run DNA, signing up for the newsletter, checking out free courses, other courses we have there. Especially I think a lot of this had a lot of relevance to our certified endurance coaching course and how that could be applied and some of the principles of how do you improve VO2. So check that out. And thanks for coming on with us tonight.
Thanks everyone for coming. Hope you appreciate it. Hope you enjoyed it. Not appreciate it. Hope you enjoyed it.
Better appreciate
Better
it.
appreciate it. Hope you enjoyed it.
All right. Thanks, everybody.
Like what you hear? Leave a review of the show wherever you listen, and don't forget to subscribe so you never miss an episode. Run DNA helps runners and running specialists through education and technology to identify each runner's unique injury profile to avoid setbacks and maximize results. The Run DNA podcast is produced by Ace Running LLC. The Run DNA podcast is intended for educational purposes only. No clinical decision-making should be based solely on one source. While care is taken to ensure accuracy, factual errors can occur. Always seek the guidance of qualified medical professionals before making healthcare decisions. Find us online at rundna.com.